welcome back to my channel, and today we're going to be going over treatment methods for gastrointestinal carcinoid. Now, before we go over the treatment methods, let's go over the specific stages first. Now, specifically, we're going to be going over cancer in the small intestine, because that's where gastrointestinal carcinoid is said to be most prominent. Now, let's go over stage 1. Now, in stage 1, the tumor available is smaller than 1 centimeter and has spread from the upper layers of the cells into further layers. Examples may include the lamina propria or the submucosa. Ernie's classification as T1. However, the tumor has not spread to the lymph nodes or other distant parts. Ernie's classification in the N0 and M0. Now, next up we have stage 2. Sorry, I'm just moving a little bit. Now in stage 2, the tumor has spread, and there is development within the lamina propria or the submucosa, and in some instances both, and has passed the 1 centimeter mark. Now, another qualification could be that the tumor has grown into the primary layer of muscle of the intestine, earning its classification in the T2. However, the tumor has not spread to the lymph nodes of other further organs, earning its classification in N0 as well as M0. Now, stage 2 could also be the tumor has developed throughout the main muscle layer of the intestine or outside of the subserosa. However, the tumor has not spread to lymph nodes or other distant organs. So it's still N0 and M0. And next up we have stage 3. Now, the tumor has developed into the outer layer of tissue encompassing the stomach, known as the serosa or visceral peritoneum, or into neighboring organs, earning classification in T4. Now, stage 3 could also be the tumor of any shape or strength, might not have reached nearby structures, so it's like a varying T, but it has spread to neighboring lymph nodes in 1, although it does not spread to distant parts of the body, earning its classification as still M0. Now, stage 4 is that the tumor may not have spread to the lymph nodes, so it's ending N, or nearby organs, NET, but it unfortunately has spread to distant parts of the body, earning its classification in M1. Now, let's go over the treatment methods involving surgery. Now, first we have endoscopic mucosal resection. Now, in this particular resection, the cancer is removed with the use of an endoscope. And it is also commonly used to treat small carcinoid tumors within the stomach and the first part of the small intestine, known as the duodenum. And it can also be used to treat small carcinoid tumors of the rectum. Now, next up we have local excision. Now, this involves the removal of a primary tumor, including some healthy surrounding tissue. Now, afterwards, the edges of the defect are put together through sewing. And it usually does not cause any long-term issues with movement involving the bowel. Now, this can also be done to combat small carcinoid tumors, but it can't be bigger than 2 centimeters or an inch. Now, next up we have the small bowel intestine resection. Now, this can be utilized for the removal of a part of a small intestine, also known as the small bowel. Now, when used to treat a small bowel carcinoid, the procedure will remove any surrounding bowel around the tumor along with the tumor, known as the partial margin resection. Now, this also removes nearby lymph nodes, vessels that connect to the intestine, like they carry blood in and out, as well as tumors in the terminal ileum if needed. Now there are some non-surgical treatments, such as chemotherapy. Now some drugs we use in chemotherapy could be capecitabine or Xeloda, dorsirubicin, etoposide, streptozocin, dacarbazine, temozolomide, very hard names to pronounce, oxaliplatin, and 5-fluorouracil. Now there can also be somatostatin analogs, targeted drugs, radiation therapy, which includes peptide receptor radionuclide therapy, external beam radiation therapy, and radioembolization. There could also be usage of interferons, liver treatments, or clinical trials. Now, thank you very much, and I hope you all have a great day.